The Paul Animal Health CPET kit provides all the sterile, disposable equipment you'll need to create a platelet therapy from autologous canine blood. The kit includes the unique CPET system, a vial of anticoagulant solution, a vial of capture solution, which is sterile water, and a vial of harvest solution. The kit also includes 3 10cc Luer lock syringes, 1 60cc Luer lock syringe, a clean surgical drape, and instructions for use. Other equipment you'll need for the procedure includes clippers and surgical preparation for the aspiration site, 1 needle and an optional butterfly catheter for aspiration of blood, 3 needles for aspiration of anticoagulant, capture, and harvest solutions, preparations for sedation or anesthesia, and post-procedure materials like bandages and ice packs. The self-contained CPET device can be used anywhere the patient needs to be treated, in the office, a clinic, even the patient's home. To begin the procedure, sedate or anesthetize the dog as appropriate. Then begin the CPET system prep. The procedure is simple but precise, so you may want to keep the instructions for use nearby for easy reference. Place the clean drape on a steady, flat surface. Then remove the CPET system from the box and lay it out on the drape. The next step is critical to preparing a proper platelet concentrate and the success of the procedure. Hang the system with the arrows pointing down from an IV pole or from a clean, convenient surface. Push the top and the bottom clamps into the closed position. Now it's time to prepare the anticoagulant solution. Preload the 60cc syringe with 5 cc's of the anticoagulant solution. You may choose to use a 19-gauge butterfly catheter to more easily agitate the blood while the blood is being collected. In this case, attach the butterfly to the syringe before loading the syringe with anticoagulant. Once loaded, take the 60cc syringe loaded with the anticoagulant solution and set it aside. Next, prepare the sterile water, the capture solution from the vial with the purple cap. Fill one of the 10cc syringes with 9 cc's of the capture solution. Before you proceed, it's critical that you check once more that both the top and bottom clamps are in the closed position. Remove the cap and inject the capture solution into port A. If you feel any resistance, withdraw the syringe and try again. The CPET system is now prepped. Next steps, the blood collection, filtration, platelet recovery, and the injection procedure. Once the CPET equipment has been prepped, the next step is to collect 55 cc's of whole blood into the 60 cc syringe that was previously filled with the 5 cc's of anticoagulant. The access site, needle bore, and use of a butterfly are at the discretion of the clinician. The goal, however, is to collect blood as quickly as possible to avoid clotting. The preferred site for the stick is the jugular vein. When the jugular is difficult to access, the saphenous or cephalic veins are also acceptable collection sites, although they will take longer to collect the blood. When accessing sites other than the jugular, using a butterfly is recommended to facilitate adequate mixing during collection and thereby avoid clotting. Now, you'll introduce the 60 cc solution of anticoagulated whole blood into the filtration system. Remove the cap on port A and transfer the anticoagulated whole blood to the top bag, gently rocking the bag and mixing it with the capture solution. When the transfer is done, remove the syringe and replace the cap on port A. Remove the CPET system from its hanging position and continue to mix the blood and capture solution by inverting the bag, a minimum of 10 times. Good results here require that the blood sample and the capture solution are well mixed. Once that's done, rehang the CPET system in the same vertical position as before, making sure the top bag is above the filter and the arrow on the filter points down. Ensure the tubing is not crimped and that the path is clear for blood flow. Open the clamps above and below the filter, allowing the blood to flow through the filter into the lower bag. The filtration process should take between 5 and 15 minutes. The filtration is complete when the flow has stopped and the unprinted side of the filter has drained. Now we're ready to recover the platelet therapy. First, close both the top and bottom clamps. Next, prepare the harvest solution from the vial with the white cap. Fill one of the 10 cc syringes with 8 cc's of the harvest solution. The platelets will be collected in the remaining 10 cc syringe. And this final syringe should be kept sterile for the delivery of the platelet therapy. Remove the cap from port C and attach the syringe with the harvest solution. Take the final sterile syringe and depress the plunger to remove any excess air, then attach it to port B. Holding the filter with one hand, inject the harvest solution through the filter with constant pressure. This should only take a few seconds. If the pressure is too great and the plunger doesn't depress easily, stop. Remove both syringes, reattach, and then inject the harvest solution through the filter. The contents of the filter will backflush to port B, and you will approximately receive 6 to 8 cc's of final product. This is the platelet therapy. It's now ready for use and should be administered as soon as possible. The final step in the canine platelet enhancement therapy is the intra-articular injection of the platelet preparation near the site of the injury or disease.
The advice I'd give to somebody who's never done an injection joint is, one, don't be intimidated. They're not that hard. And two, get the dog in the position. Take the time to get the joint positioned correctly. If you don't, you're going to get frustrated and you're going to think they're difficult. If you take the time, get the dog positioned, and possibly get a helper, you're going to find that you'll be successful. The other thing is make sure you find your landmarks. Landmarks are very important. It gets you oriented. Anytime I'm doing anything, if I get a little bit disoriented, I go back to the landmarks and I get reoriented and I can do it successfully. When I'm injecting the knee, the first thing I do is I have the position appropriate. So you don't want the knee bent, not 90 degrees, about 45 degrees. And if you have a holder, it makes it a lot easier. You're going to look for the patella tendon and the proximal part of the tibia. You find the patella tendon, you go either medial or lateral, it does not matter. You go about 2 millimeters proximal or dorsal to the proximal part of the tibia, and you go perpendicular to the joint. Usually you're right in the joint and you have no problems. The one thing about the stifle is that you might not get joint fluid immediately because it gets plugged up with some of the fat pad that you're going through. So you might have to inject a little bit of saline to get the actual joint fluid back. When I'm injecting the elbow, I prefer to go medial. 2 reasons. One, medial you can do a little shaved spot and the owners won't see it. So no one's going to see if the dog has a bald spot on the elbow, it hides it, and owners like that cosmetic appeal. Second, I find positioning medial is very simple. You put the dogs on their back. You need to have a fulcrum for the elbow. This is critical. If you don't have a fulcrum and you don't have the elbow in position, you're going to be struggling. If you get a fulcrum, something hard like a towel or one of those weights used for your x-rays, you put it under the elbow and then you pull the elbow down so it opens up the joint. Again, if you have a holder, it helps. Otherwise, you can take the paw and use some kind of tie and pull it down. In that position, you feel for the medial epicondyle, which is easily palpated even in the most obese patient. You go 2 millimeters, 1 to 2 millimeters distal to that spot, either a little bit cranial, a little bit caudal, and you go perpendicular and you should fall right into the joint. I can get a 2.7 millimeter scope in there, so you can get an 18 gauge needle into the elbow joint, even in a very small dog. When I'm using the joint injection in the hip, again, position is very important. You want the dog to be lateral. You want the femur to be parallel to the floor. If you could have a holder pull the paw away from the body, not forward or back, but straight as if it's standing. Then, as the injector, you feel for the greater trochanter. You go about 1 millimeter dorsal. And again, you should fall right into the joint. If you feel bone, you're probably just a little bit too distal, and you angle it. You can either angle it with the needle going down towards the leg or just reposition it a little bit more dorsal. You should be successful. For injecting a shoulder, again, it's position, because I find the shoulder to be the hardest joint, and it's just because of the way the shoulder is made. And if you have the shoulder in the right position, you have a better shot of getting it the first time. And what you want is the dog laying laterally. You want the leg to be parallel to the floor, and you want someone, if possible a holder, to pull the leg away from the body, not forward or not back, but straight back, to open up that joint space. Otherwise, when you go into the joint, you're going to hit the ball of the humeral head. If they're distracting, it's going to open up the joint. Then you feel for the acromion process, which again you can feel even in those well-muscled bodies, and you go about 1 millimeter distal and a little bit cranial or caudal, and you should drop right into the joint. If you hit the bone, you can try to angle it just a little bit forward or back, but you should get into the joint. If you follow those guidelines, you should be successful 90% of the time.
Insert the needle into the joint space and confirm the location by withdrawing synovial fluid. Depending on the state of joint degeneration, the amount of fluid will vary, including none at all. Without removing the needle, replace the syringe with the 10 cc syringe containing the platelet preparation. The volume of platelet preparation to inject varies from joint to joint and from dog to dog. Experience shows this volume is typically between 1 and 5 cc's. A rule of thumb is to inject until you begin to feel slight back pressure inside the joint. This means the joint capsule has been distended, and you should stop the injection at that point. Every veterinarian will have their own variations on a post-CPET treatment regimen, but we have found this post-procedure therapy to be effective. Immediately after the procedure, wrap the joint in ice for approximately 20 minutes as the dog is waking from anesthesia or sedation. Then remove the wrap. Follow your typical post-anesthesia recovery protocol and send the dog home with instructions for post-procedure care. During the first few days after the procedure, the dog may experience discomfort that can be treated with oral analgesics. Now, many dogs may be up for some exercise within a day or two, but this should be restricted to leash walking for brief periods for the first 3 days. And some dogs experience rapid improvement for the first few days and then appear to regress for a week or two before showing consistent improvement. Click on the efficacy chapter for additional details on the efficacy of CPET therapy and the initial results of an ongoing pilot program.